Hi everyone, my name is Erin and I'm going to talk about constipation, or more specifically, constipation, belly pain, and my life. It seems like every other commercial on TV is for some new medication, and the number one side effect, constipation or diarrhea. And having worked in a hospital for almost 10 years as a dietitian, I can tell you the number one topic when I visit patients, constipation or diarrhea. But what if you were born that way? If you saw my previous presentation, you know that I was born with a stomach ache. And come to my house some afternoon, and my mom will tell you stories about how she chased me around the living room trying to give me medication as a 2-year-old, and how I would make her late for work almost every day because I was stuck in the bathroom. And during elementary school, we would all line up in 2 rows during bathroom break, and I would inevitably make us late for class because I was stuck in the bathroom then too. My bowels would spasm without relief, sometimes in middle school, and I would miss parts of English or math class because my belly would hurt and I just couldn't get any relief. But to be honest with you, I never thought any of this was related to constipation. Actually, I didn't really think about it at all. It was a nuisance, a disruption in my day, and even today, I don't really think about my diagnosis of IBS-C until I'm in the thick of it and constipated for over a week. I was 17 years old when I returned from a day trip to the beach with a terrible stomach ache, worse than normal. And let me pause here and say that when I was writing down my thoughts for this presentation and thinking about that time in my life, I always get a little sad. My constipation was nothing new, and again, it wasn't really even something I thought about, but this was something completely different. A stomach ache that would change my life forever. My GI problems that had kept me from class and other activities were about to turn into a 5-year period where increasingly I was no longer able to function. I ended up going to my primary care doctor 6 times that year, and I saw 2 gastroenterologists before being diagnosed with IBS-C and provided very little medical or psychological help. I went to college the next year and became increasingly withdrawn. Who could enjoy ice cream socials, college meal plans, or McDonald's at 1 a.m. when you're afraid to eat? And that's what happened to me. I would later be diagnosed with severe functional abdominal pain syndrome, later renamed centrally mediated abdominal pain syndrome, which I guess because nobody was very functional when they had it. At that time, when I was 17 years old, I was diagnosed with IBS-C, or IBS with constipation, and the only medication I was prescribed for the abdominal pain was an anticholinergic medication called Levsin. The purpose of this medication was to decrease the spasms and the pain I was feeling, which of course made the constipation worse, and in turn, the abdominal pain worse. I started my career in pharmacy school, but switched to nutritional science because the pain was causing me to eat less and less. And if you are a patient or a caregiver of a patient watching this right now, you'll know that the daily pain, that besides the daily pain, the only thing worse is the social isolation of having a chronic GI disorder, which leads to this endless cycle. You have pain, you're afraid to eat, which is normally what most social situations are around. You don't want to eat, you don't want to go out with friends, you become more isolated, and the pain gets worse, and which makes you not want to eat. That was my life. I missed out on all my college experiences. I missed out on Dunkin' runs and late night cram sessions. I spent 4 years in the bathroom or curled up in bed. I was 105 pounds when I graduated with my bachelor's in nutrition, depressed and not sure if I would ever be able to hold down a job. It was in 2009, 1 month short of 5 years since that day at the beach, that I found my 4th and last gastroenterologist. I was diagnosed with functional abdominal pain syndrome and was able to break that vicious cycle. I remember very clearly starting a new medication about a week later, realizing that I was pain-free for the first time in 5 years, which of course didn't last, but it took a good amount of time to rebuild my life again. And I still have IBS-C. But now I have better tools to handle it and continue to take prescription medications, Miralax daily, and eat different types of fruits and vegetables that work best for my GI tract and my constipation. Constipation happens for a lot of reasons. Sometimes it's a side effect of medication. Sometimes, like me, you're just born that way. Whatever the cause or the treatment, it's important to listen to your body and never give up fighting for your own medical needs. Thank you for listening, and thank you, Cecile and IFFGD, for inviting me here today.